Welcome back to The Blend. Well, you're not getting anywhere anytime soon without them, so you better take care of them. We're talking about your feet, and our next guest has the expertise to take care of you from ankle to toe. Podiatrist Dr. Lee Wittenberg is the owner of Apache Foot and Ankle. He joins us now. Good morning, doctor. Good to have you.
Good morning, JJ. How you doing?
I'm great, thank you, and thank you for bringing your model
Of
foot
course.
here. We're also going to be talking to one of your recent clients here in a moment.
Absolutely.
But first, let's just talk about podiatry and what it really encompasses.
So podiatry encompasses quite a lot. The foot and ankle are very complicated structures. There's about 28 bones, 33 joints, and over 100 ligaments, tendons, and muscles that insert in the foot and ankle. So you're talking about a lot of different things, but we deal with the mechanics of the foot and ankle, anything from bracing for drop foot to arch supports. We do diabetic wound care and limb salvage, and we do reconstructive foot and ankle surgery. So we take care of everything pretty much from below the knee down to the end of your toes.
It is incredible. It's a very, very intricate part of the body, and frankly, it takes a lot of weight and a lot of pressure and a lot of abuse sometimes from shoes, doesn't it?
Absolutely. Yeah, shoes are a big deal. Shoes are a pretty big issue in the world of podiatry. So we do emphasize the use of better shoes, shoes that are more supportive, shoes that are structurally sound and give you the support to carry your weight through the world and to make you move better, more comfortable for sure.
For sure. I know you're staring at my 4-inch heels right now, and you're
I know.
I saw you.
I saw some issues with your feet. I did.
Yeah, no, believe me, I do. I do have foot issues. They started with ballet class as a teenager.
Yeah.
But let's go back again to your. Thank you for that close up. Wait, on my shoes. Thank you. Let's go back to your practice and all the different problems that people have that they can come see you for, because there's so many people out there watching right now who say, you know, I've got this ache, I've got this toe.
Right.
I got to take care of it.
So some of the more common pathologies that we see are, one of the major ones is plantar fasciitis. That's heel pain. A lot of older people will call it heel spur syndrome or heel spurs. People come in for correction of their bunions, their hammer toes. I'm an expert in flat foot reconstruction. My associate, Dr. Wassel, and I are both 3-year surgically trained podiatrists, and we're very, very skilled at foot and ankle surgery. You know, we also deal with fractures and trauma, sprains, and a lot of fractures and ankle fractures, heel fractures, which is called the calcaneus. They need to be fixed surgically so that everything is stable. And you know, the feet are difficult because the recoveries can be long, but you know, we are preservationists. We make sure that you keep your feet. Diabetes is a really big deal also, a very complicated issue that causes a lot of wounds and healing issues and can lead to amputations if you get a bone infection.
Listen, doctor, it's serious stuff, for real. We're going to call in one of your patients in just a moment, but first, what did you want to show us on this foot model here? I mean, it is clear just looking at this right now, so how many bones, again, are in the foot. It's incredible.
So, you know, one of the major things that I like to show people with a foot model like this, because it's a flexible model, is how these things can become deformities and how even just something as simple as a flat foot can result in bad deformities of your foot and ankle. So when your foot flattens, the entire bones move inward in your rear foot and they move outward in the forefoot. This changes the dynamics of the tendons and the joints, and it can lead to things like bunions, where you get an enlarged angle here, and then the big toe moves over and you end up with a bump here. But it can also lead to arthritic changes and tendon tears and really painful pathologies. So it's really important to support your arch, and almost everybody could benefit from arch supports.
Certainly, and you're a specialist at that. We're going to call in Tina right now. Speaking of bunions, Tina, welcome in. You're a recent patient of Dr. Wittenberg. You had a very positive experience in his office. Did you go in for bunions?
I went in for foot pain. I wasn't exactly sure what I had, but was looking for someone that was super professional, that was super knowledgeable, and the second I walked into his office, I knew that this was going to be a fit. He was able to answer all my questions, and I literally left making my surgical appointment that day.
Your gut said, yes, this is the doctor I want to work with.
Absolutely.
Yes. Yeah.
He knew everything from
Excellent.
the second I walked in. So
Excellent. You
super pleased with my results too.
Thank you, I appreciate that.
So glad, yeah. Your feet look good, and I know they feel good. That's the most important part.
She's back in high heels, like.
Yay. Dr. Wittenberg, you mentioned a new partner you have in practice with you.
Dr. Wassel, he is a younger doctor. He just finished his residency in Pennsylvania. And I'm extremely pleased with his level of expertise and knowledge, but also he shows the same kind of kindness and generosity toward the patients that I appreciate and that I try to strive for in my practice.
Excellent.
So
he's a good guy. He's a good guy.
Really good guy.
Yeah, if we got
he's
someone
very smart.
Touching our feet, we want them to be a good guy. You have a special offer for people today who are watching.
Yes, we do. We have a special offer for the first 10 people that call in and schedule an appointment. We're going to give away a pair of prefabricated semi-custom arch supports for your shoes.
Excellent.
That would be a $75 cash value. So everybody can benefit from arch supports. It does help to prevent bunions and hammer toes. It helps to prevent tendon tears and things like that.
Beautiful. Thank you so much for that, doctor. All right, Apache Foot and Ankle Specialist is located on Fort Apache near Tropicana, just off the 215. Call them or visit apachefoot.com for more information. Apache Foot and Ankle Specialist is a proud sponsor of the Morning Blend.